Hi everyone, welcome to the third episode of the Henry Schein series on COVID-19. I'm Dr. Gary Severance, your host for these events. We certainly appreciate the viewership and the questions that keep coming. It really forms the basis of what we can answer for you each week and also in the future of what we can provide to meet your needs. But we're also cognizant of the fact that not every country, not even every province or state, and some counties and cities have the same regulations. So we'd implore that you use this content to then dig deeper into your local regulations and continue your virtual contact with your patients and be their healthcare advisors during this crisis. Now, each week we want to bring you what's relevant to you, and from a clinical standpoint, that starts with Dr. David Reznik. Dr. Reznik is the director of the Oral Health Center of Grady's Health System's Infectious Control Program. Each week we reach out to Dr. Reznik to provide us the latest information and how it affects our clinical practice or intended clinical practice of dentistry. Dr. Reznik, thank you again for being with us this week.
Thanks, Gary, and I'm glad to be back for another week discussing the impact of COVID-19 or the novel coronavirus on dentistry. It's had a pretty significant impact, and we'd like to see what we're at today and where we'll be going in the future. My name is Dr. David Reznik. I'm a dentist in Atlanta, chief of the oral medicine department, and I run the oral health clinic at our infectious disease program. I have the word cloud back up again, and you might have noticed that it's gotten a little bit bigger, and I think that we'll see it get bigger as we move on through this epidemic. Some of the issues that you'll see on here now are some new words: anosmia, the lack of ability to smell; ageusia, the lack of ability to taste. These are two new early signs and symptoms that when we're screening our patients, we should truly take into consideration. But don't forget those initial symptoms: a fever over 100.4, shortness of breath, a dry cough. Other signs and symptoms include GI distress. Many folks are showing up with GI distress before they show up with the other systemic symptoms. So these are some of the words that we need to look at, some of the ideas that we need to think at as we move forward with vaccines, and we are in the present position of providing emergency care only. I did want to give you a little bit of an update on where in North America these cases are. We'll go over the numbers in a moment, but I do want you to know our hot spot is up in the Northeast. We have significant outbreaks in Georgia, in parts of Florida, in the New Orleans area now, and you can look up in Canada and see outbreaks in Quebec, Alberta, British Columbia, etc. So this is a global pandemic. It's impacting all of North America, and it's impacting the rest of the world. Our global counts as of today, literally, as of this morning on April 1st, the number of active cases are 645,000 around the world. 184,000 have recovered, and we've had about 43,000 fatalities up to this point. So the total number of cases as of this morning is 873,767. On the right side of the screen, I'm actually showing where the cases are. And of course, it depends on how well countries are reporting. We do know that Italy's been hit very hard by this, and the United States has more cases than any other country in the world, primarily due to the fact that we're testing more. Our testing abilities have increased since last we spoke, and we're also looking at some of the other countries that have been hit hard, such as Iran and Germany. We've been talking about community mitigation. This is a huge impact, and this is really impacting our dental practices throughout North America. I do want to thank the dental teams that are treating emergencies, and of course, I'm very concerned about the impact this is having on our profession and the economy associated with our profession. But what we really need to do is our part, besides treating emergencies, to talk to our family, our friends, using social media to say that if we actually do stay home, we do follow our local guidelines, that we can reduce the number of deaths significantly, we can reduce the number of people infected significantly, and you can see what it would look like if we did nothing, if we continue doing what we're doing, and we can end this with as little grief and sadness and death as possible. If we look at the United States CDC, there are new interim infection control guidance for dental settings during the coronavirus, and there's also a statement that I'm going to cover on the new COVID-19 Apple app. Whenever you're looking at dental specific recommendations, and I do have the link here, there's some interim information, but it doesn't replace what we started with in 2003, so our normal infection control guidelines for dentistry. But there are some new issues that we need to discuss. We do know that instruments are creating a visible spray, and this contains large particles of droplets that we're all familiar with that include saliva and blood and microorganisms in other degrees. The splatter only goes a short distance and it settles pretty quickly, but that is not basically the same thing that happens with an aerosol. An aerosol can stay in the air for a certain period of time, and with COVID-19, we know that it can live for up to 3 hours, but the contagion level is probably shorter. But we don't want to reduce or talk down about the risk that we face as providers when we're doing aerosol generating procedures. So we do know that the COVID-19 can live in an aerosol for up to 3 hours. It's more contagious early on. And something I think is important to talk to is that the viral load of COVID-19 is significantly present in saliva. So what is our new reality? Are we actually looking at transmission-based precautions? Forever, we've used standard precautions, which are based on bloodborne pathogens. Basically, were put into place due to the other pandemic we're facing today, HIV. But caring for patients under transmission-based precautions is really not what we're set up for or what we're designed to equip at this present time, because most of our offices don't have infection isolation rooms. We don't really worry about air transfer rates and what they should be. We don't have respiratory protection programs, which I know we're going to have in place, and we don't routinely stock N95 respirators. N95 respirators are really key because that does protect us. Especially a fitted N95 respirator will protect us against aerosol and protect our teams, and that's so very important. So our recommendations haven't changed since last we spoke. We want to postpone elective procedures, surgeries, and non-urgent dental visits. If you are sick or members of your staff are sick, please stay home. That is a recommendation we have in the hospital setting all year, every year, whether it's the flu, whether it is some kind of a norovirus that's around. If you're sick, please stay home and don't transmit. It's a really good idea to contact our patients prior to clinically urgent or emergency dental care. And we can ask those screening questions that I mentioned earlier. Have you traveled out of the country would be one in the last 30 days. Do you have a fever, dry cough, new GI distress, a lack of taste, a lack of ability to smell, shortness of breath, etc. And if people are feeling those things, we need to work together to get people to the appropriate emergency area. People who have this disease, who have completed home isolation, can be seen in an emergency dental care. So they've been infected, they have recovered, they've completed their isolation at home, and if they meet just a few criteria, 72 hours or at least 3 days have passed since they recover, which means resolution of fever. There is no temperature without medications for 3 days, and you also don't have the accompanying symptoms that I keep on mentioning about cough, shortness of breath, lack of taste. And at least 7 days have passed since the first symptoms occurred. For individuals who have laboratory-confirmed novel coronavirus who have not had any symptoms, at least 7 days have passed since the date of the first positive test, then they can come in. So I think these are some really important guidelines that people need to be aware of. Somebody who has coronavirus and they've completed their home isolation and they're medically cleared, which is why we need to work with our medical colleagues and do medical dental integration, we can see them for emergency care. I have a suspected patient with COVID-19. How do I proceed? They come to our waiting room, we contact them on the phone. Now they're basically saying they have a cough. So give the patient a mask to cover their mouths. Make sure you use hand sanitizer. You want to refer the patient to a medical facility if they're acutely sick. And if treatment is urgently needed, refer to an appropriate facility. So we always have to look at the medical benefits of what we do and the dental benefits together and do a risk assessment. If someone presents and you have somebody who is suspected to be ill, it's our job to try to facilitate their care for them as best as we can, but also to protect our staff and our team. So you really need to clean and disinfect in all the areas that we talked about before, and clean and disinfect the surfaces and supplies and equipment located within 6 feet of symptomatic patients. So if we're using an aerosol generating procedure, we want to make sure that everything within 6 feet has been cleaned, the supplies are protected, we only have hard surfaces so we can wipe them off and keep them disinfected to safely provide care. And please use EPA-approved emerging viral pathogen claims. So use products with these new claims, and there is a list, and there's a click on this PowerPoint that you can go to and find all of the EPA-registered disinfectants who have qualified for their emerging viral pathogen program. There is a new app out there. As of March 27th, the CDC did have a statement. And their statement talks about Apple releasing this app and website, which will help Americans and North Americans throughout a series of questions about their health and exposure to determine if they should seek care for COVID-19 symptoms. Phone calls and apps really do help so you can get a verbal talk with a physician, a nurse practitioner, PA, or a nurse, or look at the app before showing up to the office. The tool provides the CDC recommendations including the next steps, physical distancing, self-isolation. So God forbid I tested positive, I would be living in a room on the second floor of the house, isolating myself from the rest of my family. We monitor our symptoms, we do recommendations on testing, and of course I would contact my medical provider as soon as possible. This app is free. You can get it from the Apple App Store, or you can download it from online. So there are a lot of questions that have come in. I've tried to address many as I've gone through today's presentation so far, but there are other issues that have come up that we don't have really clear answers to. How long does COVID-19 live on clothing? And the experts are basically saying they can live on clothing for a few hours or up to several days. And so we really don't have a definitive answer. I guess it would depend on the inoculant. How much exposure do the clothes have? So it does last the longest on hard, non-porous surfaces like we talked about earlier, like stainless steel and plastic, and we do know that it can persist on things like clothing and blankets. Another thing, if someone is sick in your home, you need to handle with care. But more research is needed to understand exactly how long it will last on clothing. But until then, we do have some tips that we're going to offer and things that I do to keep our clothing clean or at least separated and our families safe. So the CDC recommendations: change your outdoor clothing as soon as you enter your home and immediately put them in a laundry. If you're handling dirty laundry from someone who has already been infected with coronavirus, or a team member, or a spouse, or family member, Please wear disposable gloves. Treat your home like you do your dental office. Disinfect any surfaces that the clothing has come into contact with. Wash your hands thoroughly for 20 seconds. I sing happy birthday a lot faster than 20 seconds. I'm actually counting these days. The CDC also says, if possible, laundering the items using the warmest appropriate water setting for the items and dry completely. Dirty laundry from an ill person can be washed with other people's clothing. I want to repeat that. The dirty laundry from an ill person can be washed with other people's items. You don't need to keep it separate. Another question that came through, are there enough test kits available? Presently and regretfully at the present time, the answer is still no. But there are new rapid tests that have become available. If you've turned on the news, I'm sure you've heard of some of them. The Abbott test is the one, and this is from their release. The Abbott test is the one that's getting a lot of press right now because you can find a positive case in 5 minutes and a negative case in 13 minutes. So we've been talking about this being a 15-minute test, but it's just 5 minutes to find a positive and 13 to be absolutely sure the person is negative. It runs on Abbott's point of care platform. It's a portable instrument that can be in ambulatory care settings, community health center settings, hospital settings, of course. We have a lot of dental offices and colleagues of mine that do work in the community health center environment. They'll be making a lot of tests available, and their goal is to get about 5 million tests per month. It did receive emergency use authorization by the FDA, and that's very important. Please only use FDA-approved items. There is something that's also new that's out there that is from a Henry Schein company, and this actually looks at whether somebody has developed an antibody. So you can find in 15 minutes with just a pinprick something you can do at a point of care, like in an ambulatory care setting, and you can use the results of this test along with their medical history and symptoms and results of other relevant testing to make informed decisions about a patient's treatment and care, and as well as whether they maybe have become immune to the virus and can return to work. So the company expects there'll be several 100,000 tests. Now this rapid test, is not one to see if somebody has the disease. This rapid test is to see if you've had the disease, you've recovered, and you formed antibodies. So you basically are protected. We don't know how long that you're protected, but we will know at that point you are protected. Then we go to, how is dentistry really going to look? Because we do know that we are going to see a peak in the epidemic in 2 to 3 weeks throughout the United States, but we also know that the pandemic is not going away, that it's going to be with us for a while, at least until we have a successful vaccine. So we're going to need to look to see what we can do to institute transmission-based precautions. And these include setting up an airborne infection isolation room or rooms, or single patient room or rooms. A respiratory protection program would need to be put in place, and this includes things like air transfer rate in the operatories, maybe having negative pressure rooms set up. For sure, we would definitely need to stock up with N95 respirators, and please make sure that they're fit tested. And that's really important to make sure you're getting the tightest seal as possible. And I mentioned before, since there's a shortage, there are things that we can do to protect our N95 respirators. Using a shield will protect the N95 respirator from getting wet. If you're not wearing a shield and using some kind of facial protection, you can put, say, a level 3 mask on top, which is very water resistant. It's not going to be resistant for aerosols. There's no data showing that wearing multiple masks is going to offer greater protection. But in this case, all you're doing by putting on another surgical mask over the N95 is preserving it for future use. Make sure that the waiting room and operatory chairs and all hard surfaces can be wiped down. So I'm building a new clinic. I'm already going with seamless chairs. Yes, there are more colors with seams, but it's easier for us to keep an infection control protocol if the seamless chairs are there. In the waiting room, let's eliminate cloth chairs because we do know that this virus can live in cloth. We need to look at having high-speed evacuation for all hygiene operatories that involve aerosol-generating procedures, like the ultrasonic scaler. So we're going to have to look at separating, having a good hygiene room available as well as a good operative oral surgery room available. In other words, we need to make sure that all of our staff are protected and our patients are protected by setting up the appropriate precautions for those we serve. So I'm looking forward to more questions. It's always a pleasure spending time with you. But the more questions you ask, the better information that I can get out to others that are watching these webinars. So thank you for your time and attention. Back to you, Gary.
Thank you, Dr. Reznik, for that clinical insight and also for taking the time to dig deep into answering many of the questions that we get. Make sure you check out the Henry Schein COVID-19 update page, henryschein.com/COVID-19 update, for the latest information regarding patient communications, regulations, connections to the ADA, and so forth. Now let's turn to the business side of dentistry and how we can manage many of the challenges we face not only as dental professionals, but small business owners. Joining us today is Ali Oromchian, founder of the HR for Health and the Dental and Medical Council. Ali, thank you for joining us and sharing your expertise.
All right, thank you, Gary. Hi, everyone. This is Ali. I am your friendly dental lawyer. So it's exciting to be back and kind of chatting about the updates to COVID-19 and all the great things that have been happening since really last week when the president signed this into law. We've had some amazing developments very recently for dental practices. This is something that's very different than we expected, but now we know a little bit more detail about HR 6201. We know a little bit about what the Department of Labor was intending. So I want to go through that now, because if you've seen any of my other videos, what you'll know is that what we said before has been now slightly modified based on what the Department of Labor tells us they want you to do. Here's the biggest change, right? Here are the biggest changes now for you to know. The FMLA and the emergency sick leave, these are the aspects of what law the president signed into place last week that we believed was applicable to all employees that worked for you, regardless of whether they were furloughed or not. That is no longer the case. So basically what that means is that if your office is closed, right, you're under some sort of state or federal or local mandate and you're closed because of COVID-19, you do not need to pay for paid sick leave or paid family leave. Right? Really important, really absolutely important, because a lot of you have been stressing, and we've been getting thousands of calls and emails and text messages about this over the last many days. So just know this: if your office is closed, you no longer have to provide paid sick leave or paid family leave to your employees. The time when they can actually use those leaves occurs after your office reopens for business. Okay, so really, really important for you to know. Now, what does this mean in terms of unemployment? Well, it doesn't change much as far as unemployment. We are still advocating, and the Department of Labor actually has put this down as well, that you should be asking your employees to file for unemployment. Okay, so if they haven't filed for unemployment yet, and you've closed your office down since last week, then or at any point during this, during this crisis, have your employees file for unemployment so that they can get something coming home in terms of revenue for their families. But for as far as you're concerned, it does not matter whether you furloughed them, terminated them, or laid them off. In any of those scenarios, you do not need to pay paid emergency family leave or emergency sick leave for your employees. Again, I keep reiterating that because it is an important part of this new law and what the Department of Labor late on Thursday night put this out there and released it, which none of us really expected. But it's been a really absolute fantastic thing for us. So what does this mean for health insurance? Well, a couple of things. If you are paying for your employees and you have health insurance, there's a couple of things that you need to do. You can still require your employees to give you to pay you their half of the health insurance premiums that maybe they're paying for themselves or for their family members. What I would say is that make sure you're discussing this with them. If there's any questions about how they're going to pay it back, have some private conversations with them on how to do that. This is very important because they may not be able to pay their half of the health insurance while while they're unemployed and only getting unemployment. And you can have a private arrangement with them where they pay it back, after the office reopens again over the next many months. If they don't pay it back, you have to give them a 15-day notice. And after that 15-day notice, you could cut off their health insurance. Again, we are not recommending that under any circumstances. We hope that most practices keep the health insurance of their employees, even though the office is closed during these times. And again, once the employees come back, you can have some sort of private arrangement with them there. Now, let's talk about some cash flow analysis. We've been advocating doing a cash flow analysis during this time because as you get ready to open up again in a few weeks, and maybe hopefully not a few months, but in a few weeks, it's important to know how much cash you have in hand and how much cash you need to really ramp back up. The thought process is that there's going to be some real pent-up demand for dentistry because patients have not been able to come in for potentially months at that point. So if there's that pent-up demand, you might open up extra days. You might hire new doctors. You might do a lot of things, and you're going to need cash reserves to make sure that you withstand this virus and come out strong on the other side. And so as a result of that, we highly recommend doing a cash flow analysis. Now, I'm a dental lawyer, so that's not something I do. Your CPA absolutely can do that for you. If for some reason your CPA does not do it for you, then let us know, and we can refer you to a couple of other CPAs that around the country that are doing this for doctors as a service because during this crisis. So make sure you reach out to us there. Now, a lot of big talk right now is about the CARES Act. This is what the president signed into law. It's the third and hopefully final stimulus package. The CARES Act, has a lot of different components to it, and we're not going to be able to get into, a lot of them today. But the reality is that there's a payment protection program called 7A SBA loan that you can use to pay for salaries, paid sick leave and medical leave, insurance, mortgage, rent, and utility. Okay, so utilities. So that's very good because it's expanded what we thought was originally in the bill. So that's great. Since this has just been passed, we're still kind of getting into the nitty-gritty, but as with most of these rules and laws, it's going to take some time, potentially days and weeks, for the IRS and the Department of Labor to comment even more on how these things actually go into effect. But there is a loan forgiveness program in place, and that's something that a lot of you are asking questions about. How does this loan forgiveness work? How do I use it, and so on and so forth. So it's important to know that the things that we do know about it is that there's an 8-week period after loan origination where you have to spend the money. Okay, so how much money do you get? Well, you take last year's total payroll cost that you had, and you take the average monthly amount, and then you multiply it by 2.5 times. That's the maximum you can get through this program. And then you have to spend it within those 8 weeks after the loan originates. Okay, so after the loan originates and you get the cash, you have 8 weeks to spend it. From there, there's a very complicated calculation to determine how much of it is actually forgiven. Now, this is very important because you could easily, not do not only just the calculation, but misapply and mispay portions of these funds that you've gotten from the SBA and not be able to forgive a ton of it. So you have to be very careful how you go about this. I'll give you an example. Salaries over $100,000 are excluded from this forgiveness program. So what that means is that if you pay yourself a big portion of it and you're above $100,000 of income, it's not going to work. You're not going to be able to forgive that portion. So my recommendation, work very closely with your CPAs on this. Don't take any chances with it. Make sure you are absolutely 100% focused on how to make sure the calculations are done correctly and how you pay. When you get the money is also very important. Remember what I said, 8 weeks after loan origination. Okay, so if you get the money, let's say May 1st, right, and the offices are still closed, well, you may not be able to use all of those funds in time when those 8 weeks are up. So at that point, you're going to have a hard time benefiting from this loan. So again, work really closely with your CPA. If you need a CPA that knows this kind of stuff inside and out, let us know. We're happy to refer you as well. A lot of you, hopefully by the time you see this video, have sent to your employees the Department of Labor notices. Okay, hugely important for you to do that. If you haven't yet, go to HR for Health's website or the Henry Schein page that we've created for HR for Health. It's basically hrforhealth.com /Henry Schein. You go there and you should have these forms available for you. So these need to be sent to all your employees. And then when the time is right, when the offices are open again, you got to post it in your in your lunch rooms in a conspicuous place where all the employees have access to it. All right. So those are the absolute most major things and updates that have happened in the last few days. There's going to be a lot more that comes over the next several weeks as we get more information about the CARES Act. It is a very, very complicated new set of laws, but much needed for our teams. And so remember, in sum, there's a couple of things I want you to take away from this. Okay, first of all, number one, the FMLA and the emergency sick leave are not things that you have to pay for or give to your employees until your office is open for business. Okay, very important. Unless you're open for business. If you are seeing emergency patients 1 hour a day or every couple of days, those don't really qualify unless you're really opening all day long for those. So if you have specific questions about that, ask us. Two, the loan forgiveness program is a very complicated but available program for you, so make sure you work with your CPA on that. Three, do a cash flow analysis with your CPA. Being able to be financially flexible at this period of time in history is vital, because we don't know what life is going to be like in a few months when hopefully business is back up and running again. So let's just keep that in mind. You need some cash for your employees, for marketing, for your patients, because when your doors open up, we do expect some pent-up demand there. But work with your CPA on that. If you need referrals, we're happy to do it. For the Department of Labor notices, make sure you get those out as well. And then finally, and probably most importantly, since many of you are at home right now and you have a little bit extra time on your hand, if you are not HR compliant, if you have not signed up for HR for Health, please sign up for HR for Health through your Henry Schein rep. Every FSC and ESS can help you with this. It's vital to make sure you've got all your new hire documents, you've got your employment manual, all of that done correctly now, so that when you open up for business, you don't have to worry about making sure you're HR compliant. Do it now, and then you can set it aside for a long time. So thank you guys very much. I hope you stay well and healthy. Gary, back to you.
Thank you, Ali. Great information. One question for you. Is there any special exemptions for small businesses like dental offices and dental practices in this plan?
That's a great question, Gary. So here's what the rules say right now. In terms of exemptions, there are some exemptions for offices, whether they're dental labs or dental practices that are less than 50 employees, but only in the circumstances if they are not financially viable. The problem is that we don't know what that means. What does it mean for something to not be financially viable as a business? So we're waiting for direction from the Department of Labor or maybe the IRS on this, most likely from the Department of Labor, but we just don't know. My recommendation is that don't rely on it until we have a little bit more information about that. But remember, based on what we just talked about, if the businesses are closed under these shelter in place types of programs, whether it's the state or county, you're not obligated to pay any of these out just yet. But once you're open for business, you could potentially have to, unless this exemption gets more clearly defined.
Thank you, Ali, for that great information. We know you and your team are keeping up to date on all the federal regulations, but also looking at individual states and their differences. So we continue to thank you for your contribution to dentistry. Now, last week we ended a little bit by talking to how you can stay in virtual connection with your patients, to be the healthcare professional that reaches out, answers any questions they may have on the COVID-19 crisis, dispel any rumors, give them up-to-date information of what your local regulations are. But there's another category called teledentistry, how you can reach out to them and provide dental care, treatment, guidance officially. Now, there are some regulations that have relaxed a little bit on HIPAA as long as you act in good faith, meaning you can use programs like FaceTime and Skype and Zoom to communicate with your patients. And on our website, again, henryschein.com/COVID-19 update, there are resources and more videos talking in depth about the teledentistry. Medpod is a HIPAA-compliant on-demand video interface. It allows you to connect remotely with patients through any smartphone, tablet, or computer. It's cloud-based, so there's no installation or app required. It allows you to provide virtual consultations, triage dental emergencies, see the patient before you allow them to come in for the dental emergencies, and enable post-procedure follow-up care. There's a small setup fee and a nominal fee per encounter, no fixed fee. And it's reimbursable by many players. You'll need to check out the ADA website or the Henry Schein update page to get a list of the various procedures that can change or various companies that reimburse, and this can change almost daily. Thank you for attending this week's webinar. We appreciate your continued interest, sharing this with other dental professionals, and providing your input. Have topics you'd like us to cover in next week's webinar on COVID-19 and dentistry? Email us at webinars@henryschein.com. And remember to subscribe to the Henry Schein YouTube page to make sure you get the latest information and updates. For more information and a full list of references, please visit the Henry Schein COVID-19 Resource Center, www.henryschein.com/COVID-19 update. Until we see you again, stay safe and stay informed.